everyone, am I audible and visible? Let me check and then we'll start. Am I audible and visible? Am I audible and visible? Okay, fine. Okay. Hello everyone, welcome to Unacademy Future Doctors. I myself, Dr.Dipti. I am MD, PhD Physiology. I am Associate Professor and I'm educating MBBS Nursing, Physiotherapy, Dental, Homeopathy and Ayurvedic students as well as MD students too. And I have more than 17 years of teaching experience. Now, first I would like to tell you that in this channel, we are posting videos. These videos are very useful for first MBBS, Physiotherapy, Nursing, Homeopathy and Dental students. So please, if you have anyone in your family or friends, those who are planning to take admission in all these branches, please share these videos with them. Okay? Now, let me explain in brief about our subscription. We have two kinds of subscriptions. One that is plus subscription. Here you can choose the best from the best. Here you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. Here you can access QBank, which is having more than 25,000 questions. You can compete in the live test and quizzes, and with 12 months and above subscription, you will be given printed notes too. And next is iconic subscription. Here your access to the best from two of the best, and they are one that is Unacademy and Preload with Unacademy. Here all the features I have explained, and second that is Unacademy and Preload with Preload. Here features are you can have clinical and integrated essentials, video lectures from the dream team, question bank 3 with active guidance, system tags and more, rapid revision and snapshots and treasures and 2021 dream notes. We also have added certain features in our special class. We made it interactive and live class. You can have facility of raise a hand. You can talk to your educators in the live class and get your doubt clear during the class. You can poll for the learners too. You can never miss a class as you're always notified for your class. You can get lecture notes, PDF notes you can download from your lectures of special classes, and you can access your class anywhere and at any time. Also, we have upgraded a highly effective question bank, which is having more than 25,000 high yield clinical questions. These are based on latest exam pattern, and this includes detailed explanation too. These are our NEET PG September 2021 toppers. This is our exam schedule. You can see here we have pre-test rituals as well as plus batch test rituals. Also, we have started a Focus FMG 2022 comprehensive batch from 15 December 2021, that is for 6 months, and second that is Target NEET PG 2022 test and discussion batch from 15 December, that is also for 3 months. So you can subscribe from your mobile, you can subscribe for plus or iconic subscription, and longer the duration of subscription, cheaper are the rates. You can use my code DIPTI10 to get 10% extra discount on each and every subscription. Okay, now let us come to our today's topic. Learning objective in today's topic, they are, as we have discussed about contractile response. In today's class, we will discuss about various factors affecting contractile response. Yesterday, we have discussed about this frequency of stimulus issue. Hello, hi, welcome to the class. And second, that is strength of stimulus. Also, we have discussed in our previous class. Okay, so today we'll discuss about temperature. Also, we have discussed effect of temperature. Then so we'll discuss here effect of load. Okay, very important topic. Yesterday also I told you, if you are not attending the class, you cannot understand this properly. So today we'll discuss about effect of load on the muscle and effect of initial length of the muscle on the contractile response. As we have discussed, what is your contractile response? This is your contractile response. Contraction followed by relaxation here. Okay, so this is contractile response. Okay, now what happens when we are adding load. For example, suppose if you have to contract your muscle with load, what will be the response? So that is your effect of load on the contractile response. Now we will discuss what is load. First of all, what is load? Okay, so load is, as you say, load, that is the force. You can write down this. It is the force which is exerted by weight of an object. Means suppose we are lifting a weight, so weight of object, it exerts force which is exerted by weight of the object on the muscle. Okay, so if suppose muscle is contracting with load, then with weight, this weight, it exert force, and this is your load. Okay, we have two kinds of conditions. Number one is free load or preload. Means load is already present. Okay, and afterload means load lifting starts after muscle has started contraction. Okay, I repeat, preload condition means load starts acting before muscle starts contraction. Before muscle contracts. Okay, and after, name itself suggests, load starts acting after muscle starts its contraction. Okay, so this is the difference. Okay, now we will discuss what is it, what these two things, and what are their effects. Okay, so first we will discuss about effect of free load condition. Okay, free load is also known as preload. Okay, free load or preload. Okay, what is it? This is the load, as I told you, which acts on the muscle, before it starts its contraction. Before it starts contraction. Okay, this is your free load. Okay, what is the example? Suppose you are lifting a bucket, filling a bucket, or you have lifted filled bucket. Okay, you have a bucket in your hand which is full of water, and now you are lifting it much more. So what happens? Initially you have already lifted, so the load has started acting on your muscle, your biceps and triceps, before it has started contraction. So you can see here, this is preload. Initially, before muscle starts its contraction, your load stretches it. Okay, so in preloaded condition, force of contraction and work efficiency of muscle increases. Okay, so work efficiency and force of contraction, work efficiency increases. Okay, now what is the reason why? Because there is passive stretching. Muscles are stretched. Why are they stretched? Because of the load. Load stretches muscle. So this is the reason why athletes, they do stretching. Stretching results in increased passive stretching of muscle, increases passive tension. So what happens? There is increase in the passive tension. Okay, so muscle contraction increases. So this is one of the effect. Okay, now this passive tension increases force of contraction. How? By one is increasing initial length of muscle. What is initial length? Initial length means, you can see, length of the muscle before it starts contraction. Okay, length of muscle before it starts contraction. Okay, that is our initial length of muscle. Okay, now, as well as because of passive tension, what happens? Elastic recoil forces to the muscle, they are added. Whatever elastic recoil forces to the muscle which are during muscle contraction, they are added, and because of this elastic recoil forces, passive tension increases force of contraction. Okay? So here, this work done, or you can say contractile response, both are increased in free loaded condition. Very important thing here is up to physiological limit. I will explain you with some simple example. Suppose if you have a rubber band, so if you stretch the rubber band and then release it, what happens? It contracts more. More you stretch and leave, more will be the contraction. Okay, the same happens in our skeletal and cardiac muscle. More you stretch initially, more you stretch, more will be the initial length. You can see here, suppose this is your rubber band and you are stretching it like this much, and you release. So what happens? It contracts more. Okay, but very important thing, very important word here is physiological limits. Up to physiological limits. Sorry, here फिजियोलॉजिकल लिमिट से ज्यादा खींचोगे तो टूट जाएगा. तो स्टार्लिंग्स लॉ, फ्रैंक स्टार्लिंग्स लॉ याद रखना है. विद इन फिजियोलॉजिकल लिमिट force of contraction is directly proportionate to initial length of muscle fiber. easily याद रखना है. मैंने रबर बैंड का एग्जांपल दिया. रिमेंबर दैट रबर बैंड को विद इन फिजियोलॉजिकल लिमिट जितना ज्यादा स्ट्रेच करोगे ज्यादा इनिशियल लेंथ रहेगा. मोर इनिशियल लेंथ, more will be the force of contraction. Am I clear? So this is your Frank-Starling's law. Very important word here is physiological limit. मैंने वो भी बताया, physiological limit से ज़्यादा stretch करोगे then it will be broken. So again, what is Frank-Starling's law? Within physiological limits, force of contraction is directly proportionate to initial length of muscle. More the initial length, more will be the force of contraction. Okay, now next important thing is the length. Ayush, hello, welcome to my class. Now length tension relationship. Issue, ma'am, have you any idea about NEET exam date? NEET UG or PG beta? Issue, NEET, which NEET? You are in which year? Let me know. Okay, fine. I think NEET exam date UG. UG will be, that is at your schedule date, है ना? Mostly that is in your April May, जो भी डेट होता है. अदरवाइज आई डोंट हैव मच आइडिया. आई विल लेट यू नो. एक बार कंफर्म करके आपको बताऊंगी मैं. ठीक है, अभी मुझे कुछ आइडिया नहीं है. मैं एक बार पूछ के किसी से देन मैं बता रही हूँ आपको. ठीक है, फाइन. नाउ सो लेट अस कंटिन्यू. लेंथ टेंशन रिलेशनशिप. नाउ व्हाट इज दिस? This is the relationship between length, muscle length, and tension in the muscle. Okay, so what we do here is we are measuring the length of muscle. You can see here different centimeter, 1 2 3 4 5 6. Okay, and this is the tension developed. So what happens, what we do here is we are measuring the length. Suppose you are increasing length and you are watching that how much tension is developed. So here muscle is attached to lever and which does not allow shortening of the muscle. So what happens when shortening will not be allowed? What happens? Tension changes. As I told you, two types of contractions, isometric and isotonic. Okay, so if it is isometric, length remains same, then tension changes. हमें क्या measure करना है? Tension. तो सेम क्या रखना है? लेंथ. एम आई क्लियर? सो जो भी मसल है उसको फिक्स कर दो. ये मसल है सपोज, फिक्स करो दोनों जगह पे. सो दैट, वेलकम इशू. हाँ, सो दैट व्हाट हैपन्स, लेंथ विल नॉट चेंज एंड टेंशन चेंजेस. सो हियर व्हाट हैपन्स, व्हाट वी डू इज we just suppose our length is 3 centimeter. So this is your tension. Okay, so tension developed is recorded through this graph. Okay, so this tension developed in the muscle is proportional to cross bridges between actin and myosin filament. You can see here, very important thing is, you can see when length is less, here tension developed is less. There is one length at which tension becomes maximum. After that, if you increase the length, then tension will be going to decrease. Why is it so? Because initially what happens when the length is less, what happens, you can see your this actin filaments are overlapping. देख यहाँ पे दिख रहा है, ये actin है, this one. This is myosin filament. I will just show you again. You can see this is your Z disc. These are your actin filaments. Okay, this is myosin filament. You can see here. So this way. So all the cross bridges are not attached, or all the myosin heads are not attached because some of the overlapping is there. You can see here, suppose this is myosin. Okay, these actin filaments are overlapping to each other, so it cannot bind with all the myosin heads. So what happens, initially there is less number of cross bridges, so less tension developed. Then gradually as the length increases, then once there is a time when maximum cross bridges occur, and when maximum cross bridges occur, you can see tension developed is highest. Then again, if the length increases more, what happens here, you can see these actin filaments are away from myosin. You can see here, so now cross bridges are less. Center में cross bridges नहीं बन रहे. Again tension decreases. Am I clear? So this is the reason tension developed is highest when cross bridges are highest. Okay, so again you can see here. So you can say active tension is maximum at optimum length of the muscle. This is your optimum length, the length at which we have discussed. What is optimum length? The length at which highest active tension, highest active tension develops, and total tension is equal to active plus passive tension. Optimum length we have discussed. Passive tension is because of stretching, as I told you. Okay, and active tension is because of cross bridges. Okay, so now you can see here, as I told you, when muscle length is less, you can see here what happens, overlapping is there, so less cross bridges here. Okay, at optimum length maximum cross bridges are there, and when muscles are overstretched, you can see here no cross bridges are there. So when the muscle length is less, then also less cross bridges. When muscle length is more than optimum length, then also less cross bridges are there. Okay, now recording here, passive tension is also recorded. You can see here active tension gradually increases and then decreases, but passive tension, you can see it starts increasing from your optimum length and gradually it increases, but your total tension is because of active plus passive, and active decreases more. You can see here there is decrease in the total tension. So this is the actual graph. Why passive tension increases here? Because of stretching of your series elastic component. Which are series elastic component we have discussed? Our contractile components are actin and myosin. Okay, so this is, you can see we have actin, myosin here, and in our tendons we have series elastic component. So now after more increase in the length, what happens, your series elastic components, they have started stretching, and once they are stretching, you can see here there is stretching of parallel plus series elastic component, that increases passive tension. Am I clear? And active tension is only because of contractile component. Remember, this thing is very important. Active tension is due to there is your active tension is due to contraction of contractile component. Okay, contraction of contractile component, they are your actin and myosin, and passive tension is due to contraction of series elastic component and parallel elastic component. Okay, now this is your length tension graph, molecular basis. You can see, as we have discussed, this is just a revision. Optimum length is the length where maximum active tension is there, maximum cross bridges they develop. Okay, now, and muscle length, when, as I told you, less than optimum length, you can see here there is overlapping of thin and thick filaments and less active tension. When muscle length is more than optimum length, then stretching is there. Okay. Now, next is length tension relationship. This is the same thing. This is optimum length. But during isometric contraction, as I told you, length remains same. Isometric contraction. Okay. Tension developed. Very important thing here is directly proportional to cross bridges formed. Okay, I told you. And this is your active tension. Active tension is due to cross bridges. Passive tension is because of contraction of series elastic component and parallel elastic components. Okay, now, what are the effects of free loading condition on the muscle contraction? As we have discussed, muscle contraction like this. Okay. So, now what we do is we are just adding different your loads and watch the effect of various contractions on or various load on the muscle contraction. Okay. So, we will discuss here it. Okay. You can see here this one. First is 10 gram. So initially you can see here this red one, first wala red one. So जो normal है उससे, this is normal, blue one is normal, no load. This is no load. Okay. Now you can see here when you increase load, initially what happens? Your latent period decreases. Okay. So initially latent period decreases. Gradually you can see when you increase the load, here also latent period decreases. Then 30 gram, now latent period starts increasing. You can see here 40 grams latent period increases. Am I clear? So up to your this 20 gram is the highest load. So this load is known as optimum load. So up to optimum load latent period decreases. Means जल्दी जल्दी कॉन्ट्रैक्शन चालू हो जाएगा. देन हाइट ऑफ कॉन्ट्रैक्शन, दिस इज हाइट. ओके, यहाँ देख रहे हैं इनिशियली 10 ग्राम में हाइट बढ़ रही है, 20 में बढ़ रही है, देन 30 40 में हाइट डिक्रीजेस. हाइट ऑफ कॉन्ट्रैक्शन इनिशियली इंक्रीजेस देन डिक्रीजेस. latent period initially decreases then increases. Contraction period remains same. It is not much affected in free loading condition. You can see here contraction period mostly remains same. यहाँ थोड़ा कम लग रहा है. क्यों कम लग रहा है? बिकॉज लेटेंट भी कम हो रहा है, सो contraction भी ऐसे ही आगे जाएगा. Okay, so contraction period or active state, this is known as duration of active state, it remains same. Fourth one, relaxation period decreases with increased load. Why? Because load के साथ करना है. अगर हमें कुछ लोड लेके चलना है तो हम क्या करेंगे? सीधा नीचे रख देंगे. तो ये क्या हुआ? लीवर जल्दी नीचे आ जाएगा. What we are recording is with the lever. Lever moves up, contraction. Lever moves down, relaxation. This way. तो जैसे लोड बढ़ रहा है तो लीवर is coming down fast this way. This is your relaxation period that decreases. Then velocity of shortening is not affected. How much it gets contracted, that is not affected. Okay. And work done that is height. Work done कैसे calculate करते हैं? Work done is equal to height of contraction into weight. तो यहाँ पे देख रहे हैं weight थोड़ा सा जब बढ़ रहा है 10-20 तो height बढ़ रही है. Okay. Then gradually your height decreases. So work done भी initially increase होता है फिर decrease होता है. ठीक है. So this is very important thing. All changes in the free loaded condition. Latent period decreases first, then increases. Height of contraction increases, then decreases. Contraction period remains same. Relaxation period decreases always. Velocity of shortening not affected. Work done increases till optimum load and then decreases. Okay. Now, what are the advantages of preload? As I told you, initially there is stretching. So stretching of muscle fiber leads to increase in the initial length. हम फिर से आ गए फ्रैंक स्टार्लिंग्स लॉ के ऊपर. है ना, रबर बैंड को खींचना है, so more the initial length, more will be the force of contraction. जितना आप खींच के छोड़ोगे ज्यादा contract होगा. But very important word सबसे पहले आना चाहिए, within physiological limits. Within physiological limits, उससे ज्यादा खींचोगे तो what happens, it will be broken, टूट जाएगा. So what is Frank-Starling's law? Within physiological limit, force of contraction is directly proportionate to initial length of muscle fiber. Very important thing here is Frank-Starling's law is applicable to skeletal muscle and cardiac muscle. Okay, very important thing. इसीलिए जो एथलीट्स होते हैं ना, जो रनिंग करना होता है, वो पहले स्ट्रेच करते हैं मसल को, स्ट्रेचिंग, तो इनिशियल लेंथ बढ़ेगा, फोर्स ऑफ कंट्रैक्शन भी बढ़ रहा है. ठीक है. नेक्स्ट इज इफेक्ट ऑफ आफ्टर लोड ऑन द मसल. नाउ व्हाट इज आफ्टर लोड? हियर लोड एक्ट्स ऑन द मसल, load acts on the muscle after muscle starts contraction, after muscle starts contraction. This is afterload. Okay, and afterload oppose the force produced by muscle contraction. तो लोड होता है वो ऑपोजिट एक्शन करता है फोर्स से. सो ऑलवेज हियर यहाँ पे स्ट्रेचिंग नहीं होगी. वाई नहीं होगी? बिकॉज लोड एक्ट्स आफ्टरवर्ड्स, पहले नहीं एक्ट कर रहा है, उसके बाद स्टार्ट करेगा, तो हमें लोड को लेके जाना है. सो दैट इज लोड opposes the force, and therefore you can see force of contraction or work done decreases with increase in the load. Load बढ़ रहा है, load increases, force of contraction decreases. This is afterload. Okay, then now what are the effects? अभी इस पे क्या डायग्राम बनाना है? Nedis, what you have written I am not getting, beta. Write down which I can understand. V U R F Y I. What is it, beta? Now, so you can see 10, 20 here. Very important thing is as you increase load, you can see height decreases. Okay, height of contraction decreases with increase in the load. Okay, latent period always you can see increases. सबसे पहला ये वाला आएगा, सॉरी 10 का लेटेंट पीरियड, फिर 20 का बड़ा, 30 बड़ा, 40 बड़ा, तो लेटेंट पीरियड इंक्रीजेस. देन कॉन्ट्रैक्शन पीरियड. व्हाई लेटेंट पीरियड इंक्रीजेस? बिकॉज दिस सीरीज इलास्टिक कंपोनेंट्स, they are more and more series elastic components are slack of series elastic component, and they are required to be taken before load could be lifted. They are required. Contraction period decreases. यहाँ देख सकते हैं आप, ये वाला हमारा 10 ग्राम है, दिस वन, फिर 20 में ऐसे आएगा. तो यू कैन सी हियर दिस इज द contraction period of 10 ग्राम, दिस इज द contraction period of 20 ग्राम. ये देख सकते हैं आप ना, दिस इज रिड्यूस्ड. ओके, contraction period decreases with increase in the load, and contraction period is active state. It is duration of एक्टिव स्टेट, ड्यूरेशन ऑफ है, तो यहाँ पे बता सकते हैं एक्टिव स्टेट का ड्यूरेशन कम हो जाएगा विथ इंक्रीज इन द लोड. ओके, देन नेक्स्ट इज हाइट ऑफ कंट्रैक्शन टू कंट्रैक्शन पीरियड indicates velocity of shortening, and as we know that height of contraction decreases, so velocity of shortening is equal to height of contraction upon contraction period. Okay, so height decrease हो रहा है तो velocity of shortening is also reduced. Okay, then relaxation period. यहाँ देख रहे हैं ये 10 ग्राम है, सपोज दिस इज 20 ग्राम, तो यहाँ पे आप देख सकते हो, यहाँ पे सॉरी दिस वन contraction period, और ये पहले का contraction period है, दिस वन, दिस इज relaxation period. सेकेंड वन का दिस इज contraction, this is relaxation. So this is also reduced. Okay, and relaxation period is decreased along with contraction period. Okay, but here very important thing is relaxation period is affected more than contraction period. Why is it so? Because the ratio of contraction period to relaxation period, which is normally just little less than 1, now it increases significantly. तो यहाँ पे देख कह सकते हैं कि relaxation period decreases more. And here also same thing, because load is to be lifted, relaxation period acts on the muscle during load acts on the muscle during relaxation period also, and therefore you can see relaxation period is reduced. Okay, so क्यों हो रहा है वो आगे भी बताया मैंने, लीवर को जल्दी से नीचे पुल करेगा. So you can say that relaxation period is reduced. Okay, so this is all about effect of preload and afterload. These are the questions. We will discuss all these questions and their answers in our special class. If you wish to write down the questions, you can find these answers. I will discuss all these answers of these questions in my special class. My special class that is scheduled on 15th of January 22 at 2 p.m. Okay, you can go to app and you can find, if you wish to get all these answers, attend my special class. Just I am enumerating questions here. What is load? What are different types of load? What is free load condition? Explain with example. What is Frank-Starling's law? At which length active tension is maximum? Then what is total tension? Question 6, what are the effects of muscle length on the tension developed? Then what are the effects of free loading condition on the muscle contraction in now muscle preparation? Question 8, what is afterload condition? You can find these answers too. Question 9, what are the effects of afterloading condition on muscle contraction in the now muscle preparation? Okay, so these are the questions. Try to find out answers of these questions. And otherwise we will discuss this on my special class. Special classes are free classes on our app. Okay, so if you wish to discuss all the question answers, I will discuss all the question answers on the free special class on the app. Special class is on 15 January at 2 p.m. and other, that is MCQ special class, that is on 16 January at 9 p.m. This is for question answer and this is for MCQ. Okay, so if you wish to attend my special class, please go to the app, enroll yourself, and you will get notified for this. Okay, thank you. If you like my video, you can like it, you can share with all your friends, and you can subscribe our channel Unacademy Future.